Ellen Taverna from the ARC of Massachusetts. Thank you so much to everyone that's joining us today. This is our Friday federal COVID-19 update. We have two very special guests with us today. We're very excited about it. We have Susannah Savage, who's the Assistant Director for the Oversight and Investigations at the Office of Senator Warren. And we have Adam Axler, the Policy Advisor at the Office of Senator Markey. So thanks so much for joining us today.
Thanks for having us.
Yeah, thank you.
So I hope many of you are familiar with the ARC. We are an umbrella organization with about 17 chapter affiliates in Massachusetts, and the mission of the ARC is to enhance the lives of people with intellectual and developmental disabilities, including autism, and their families. And we fulfill this mission through advocacy for community supports and services that foster social inclusion, self-determination, and equity across all aspects of society. So for today's agenda, as I mentioned, we have Susannah and Adam, and they're here to give us an update on what's happening in the Senate and in Congress in general for the fourth COVID-19 package and a few other updates. And they're focusing on the priorities and impact of COVID-19 on the disability communities and what Congress is doing to help with that. And then we'll go over some of the advocacy that we're doing around the packet, the fourth COVID-19 package, and then we have a few other Massachusetts-specific policy updates and federal updates. And we'll allow time at the end for questions, but I am going to break after Susannah and Adam speak and allow you guys to ask questions directly to them, and then we'll go back and just do a few more updates. So I'm going to turn it over to Susannah right now.
Great.
Thank
you. So I guess to start, to provide sort of framing of where things currently stand, and some of you may already know this, but over the course of the past few weeks, the Senate and the House have sort of been seesawing back and forth as to who is writing the initial draft of the variety of coronavirus packages that have been passed. Right now, the pen is with the House to draft an upcoming coronavirus package, which folks are calling C4 or CARES 2.0, related to the most recent bill that was passed. So we've been working really closely with our House counterparts, including members of the Massachusetts delegation and others, to make sure that priorities for the disability community are included early in these drafts, to make sure to increase the likelihood that they get passed through and ultimately becomes law. Last week, Senators Warren and Markey, along with a number of their colleagues in the Senate, sent a letter to House and Senate leadership calling for a number of priorities to be included in the upcoming package, including boosting Medicaid funding to support folks with disabilities and make it easier for states, since their budgets are so strained, to continue to provide services in need. That would include an increase in what's called the FMAP, to basically give states more money from the federal government to provide services. We also called for providing an additional $50 billion in dedicated funding for home and community-based services to make sure that folks are able to stay in their communities, in their homes, and receive care there, as opposed to needing to go into any, an institution, particularly given how COVID-19 is sort of spreading in places like nursing home and assisted living facilities, et cetera. We also called on leadership to protect the civil rights of folks with disabilities, to prevent things like rationing of care. The Department of Health and Human Services has already put out some guidance on this topic, and Senators Warren and Markey have weighed in with them, but we think it's really important that sort of legislative text is included in the upcoming package to make sure that it's very clear that Congress is conducting oversight of this and prioritizing these needs. I don't know if we can go to, yep. So then sort of 4 other priorities that were included in that request was to expand paid leave protections for the disability community to make it easier for people who are staying home to care for a family member, to get the paid leave that they need. We also want to make sure that we can provide emergency income relief for folks with disabilities. And I know Adam will have a bit more to say on that in a minute, but wanting to make sure that folks' benefits are not adversely impacted by, receiving a stimulus check or anything else that are, typically means tested programs. We also want to make sure that folks can access the food and medication that they need, and that there's a plus up for services that provide food and medication to community with disability. And then finally, we called for an expansion of PPE to ensure that people who need PPE, like masks, can get them. There's a shortage of PPE right now across the nation, as many of you know, and there's a number of things that Congress could do, ranging from requiring the president to implement the Defense Production Act to, issuing contracts, additional contracts, et cetera, to expand PPE supply. So we're hoping that Congress will make that a priority in C4. And I'll turn it over to Adam to talk about a number of other priorities that we're focusing on as well.
Thanks, Susannah. So, I guess the first couple of points to make from the outset, one being that, Susannah and I are in constant contact, and we joke about how we need to have like different methods of communication because we're emailing back and forth so often. But I think the message that we both wanted to send being on the call is that both Senators Warren and Senator Markey are really working together to ensure that we're trying to address the issues that are facing the disability community in the response to coronavirus. And I guess the other point to make too, before I go into a couple pieces of legislation, is that I think what we're trying to do is recognize that what we're seeing from coronavirus is that it's disproportionately affecting a whole host of different communities, one of which I think is folks with disabilities. And so we're trying to sort of imbue our response throughout throughout our response concerns of the disability community into that. So I wanted to talk about, I know Susannah talked about a letter that her boss led and that my boss joined, highlighting some priorities that we want to see in the fourth coronavirus package. I think another way of emphasizing that is introducing sort of standalone pieces of legislation that then can be sort of grabbed and placed into a fourth coronavirus package. And so there are two bills I want to talk about. One is the Recovery for Seniors and People with Disabilities Act, which is being led by Senator Casey, and is co-sponsored. My boss is the original co-sponsor of that. And it does a number of things. It halts continuing disability reviews, collections of overpayments, and cessations of benefits for individuals who are failing to provide information by specific deadlines, during the pandemic. It prevents the Social Security Administration from finalizing a number of damaging rules that they're in the process of, or would prevent SSA from finalizing those rules. It would eliminate the 24-month waiting period for Medicare coverage for SSDI benefits, and also expand eligibility for low-income subsidies and a couple of other programs that help cover the costs of drugs and doctor's visits, and also eliminates an asset test for those programs. It has a number of other provisions. Some overlap with some of the items that were included in Senator Warren's letter. If we go to the next slide. And then another piece of legislation, this is the All Dependents Count Act, introduced by Senator Smith of Minnesota. And this would extend the coverage of the recovery rebates to all dependents, including those who are over the age of 16. So currently, if there is a $500 credit under the, I can't remember now if it was under the CARES Act or under the Family First Coronavirus Response Act.
It's the Family First.
Yeah, I think that's right. So that's the second of the sort of, at this point, 3.5 or four large bills that Congress has passed on this. But, and that, as you all know, excludes dependents who are over the age of 16. And so what this would do is allow dependents, regardless of age, to be covered by those recovery rebates. There's a House version of that bill that has about 150 co-sponsors. I don't know the latest number of co-sponsors because the Senate is like sort of in and sort of not in, and so it's been hard to update co-sponsors. But I think that's another issue that we're certainly pushing for going forward. And then the one last thing I wanted to say, and it's not on our slides, but there are a number of other letters that Senator Markey, and a number of which I know Senator Warren has joined too, that are trying to address the needs of the disability community as we're going through this response. So there's a letter calling on HHS to ensure that communications about coronavirus are accessible for all, including people with disabilities, and that's both around communications about eligibility for benefits, but also communication around just information about the disease. There's a letter that I know Senator Warren's office joined on that's maintaining our commitment to IDEA and ensuring that we provide funding for the Individuals with Disabilities Education Act, so that we don't walk away from our commitment to provide free public education in the least restrictive environment for everyone. There's a push that both of our bosses have been really instrumental on around ensuring access to information or data around disparities in coronavirus. And so, and we've been really, we've made sure to include data about disability and the disproportionate impact on individuals with disabilities in those efforts. And then we're working also on a push to try and lead the sort of entire mass delegation as well, to show support within the mass delegation for a number of these priorities. And I think that's something that we're hoping to see over the next couple of days. So those are the points I wanted to hit on.
Thanks, Adam. And I think a point that Adam made that I just want to reiterate is that from a logistical standpoint, the Senate is currently in session and working on legislation, but the actual ability of offices right now to introduce legislation is somewhat limited on the Senate side due to a variety of social distancing requirements and how our side works differently from the House. So as Adam mentioned, a lot of House bills are being able to be introduced right now, but there's some confusion and it's not as clear as to how Senate bills are being introduced. So if, as you know, we continue along this pandemic, there's a bill that's you see on the House, but it's not in the Senate, and you're confused about whether Senator Warren or Senator Markey support it. We probably do, and it's just not as public. The information about our co-sponsorships or support is not as publicly available as it is during a non-pandemic time period. So please, feel free to reach out to our offices, and Adam and I will make sure that we're as responsive as possible to get you answers. But just flagging in advance that there's been some confusion over the past few weeks among both Senate staff and outside groups. So we're doing our best to be as transparent as possible within the limits of what we're dealing with on the Senate side.
Agreed. Thanks.
Great. Thank you so much, Susannah and Adam. And I just want to thank Senators Warren and Markey for being such champions for this disability community. I mean, your offices were always champions before, but especially now, given COVID-19, I've really been impressed by what Senators Warren and Markey have been able to do, and they've been great leaders for us. So we appreciate all the work that you're doing. So I'm going to open it up for questions right now for everyone. I have a few myself, but if you can either unmute yourself or you can chat in the chat box if you have questions for Susannah or Adam.
Carrie raised her hand. Carrie, you want to unmute yourself and ask your question?
Yep, I'm here. First of all, thank you very much for all that you're doing. I have two, one is a question or request, actually both of a requests. The first one is, wherever I see food and medication, could we also add coverage for durable medical equipment? My son has an ileostomy bag and we're doing okay, but over the course of his life, the needs that he has, access and reliable coverage has not always been easy and has required an extraordinary amount of work on the part of his doctors. And right now, I want to make their job easier, not any harder. So just everywhere we see medication and food, can we also add durable medical equipment? and in parentheses, DME. That can be pull-ups, that can be oxygen, that can be CPAP machines, ileostomy bags, the special kind of tape, all of that stuff. And then the second thing, in terms of a little bit off of this, but I raised this yesterday in the ARC Zoom meeting, and I'd like to raise it or plead with everyone to please advocate for the kids like my son who will not be able to go back to school until there is either a vaccine or a reliable and safe treatment. My son is 20 years old, 79 admissions to Boston Children's Hospital, 8 near fatal events. He's a rock star, he's great, but at this point in his life, he has very few antibiotics that are both safe and effective. So his cliff, like many others in his profile, is very steep. So the two things are including DME in every conversation about medication and food, and highlight the need for a plan for kids who are going to have to receive their IEP at home or some other way, ensuring that, you know, whatever, we have to think out of the box, because those kids will not be able to go back to school or on the bus safely. And there's a lot of discussion about sending kids with disabilities back first. No, it needs to be at the end of the safety train for kids with limited choices in terms of antibiotics.
Thank you so much for that, Carrie. And I'm going to let Adam touch on some of the education pieces, since I know he has more expertise in that area than I do. But on durable medical equipment, that's definitely something we can talk about, finding ways to highlight. I think both, you know, in terms of it just being a need that you all have, as well as the supply chain issues and the shortages that have come up related to COVID-19. I know that just dealing with the supply chain generally, not just for coronavirus specific products, but also for drugs and devices and materials that have gone into shortage as a result of it, is something that Senator Warren's been focusing on, as has Senator Markey. So we can absolutely have conversations with each other, as well as with Senator Casey and our other sort of Senate leaders on this, about ways we can highlight that issue. And Adam, I'll let you speak to anything else you want to mention on that.
Yeah, two points. One is, I think, you know, I mentioned the letter that both of our bosses signed supporting IDEA, and I think a component of that was including a request for $11 billion to support states' efforts to continue to meet IDEA obligations and the commitment really that is in IDEA. And I think we're going to need that to be able to facilitate some of the sorts of distance learning or other sorts of programs that you're talking about, to protect kids who have you know, compromised immune systems and aren't going to be able to go back to school right away. Maybe they have an IEP, they have needs to be able to receive education, but we need to be able to meet those in sort of innovative ways, and we need to be able to fund that too. That's ultimately how you get it. The other point to make too is, you know, I think for us, my boss has been a really big leader on E-rate and on including money in the fourth package or the next package that would expand access to broadband. Because I think if you have folks who are at home and don't have access to the internet and the ability to sort of participate in these now online programs, then they're not going to have access to education. And so that's another piece that my boss has really been focusing on as well. But I think will help to address some of the access to education issues.
Can I just add one quick thing, is that it's the one-to-one person aid that is in his IEP. He cannot access his IEP. And since I'm doing all the medical care, I don't have the ability to do that. So it's that in-person piece. It's not the technology. It is how do we get those one-to-one staffers in person safely for them and for our families. That's the key.
Yeah, and I would just say too that, I mean, I think we've been conscious to include personal care attendants in the folks who have access to PPE. I know my boss sent a letter to the White House Task Force calling on them to include a broader array of frontline workers in the sort of definition of who needs this PPE, and to make sure that we're taking care and getting protective equipment to those people, because I think without it, they're not able to to provide the services that people need in their homes. So we hear you. I think it's definitely an issue that we're thinking about, and more than happy to connect on the sort of getting the support from school district side to the extent that there's a federal hook.
Thank you. It looks like I just wanted to add, so I misspoke before about the All Dependent Children Count Act, that it would expand on the CARES Act, so not the second federal package. I just wanted to note that. We have a question from Deborah Stevens on PPE. Deborah, do you want to unmute
Hi,
yourself?
thank you. Yes. So I have a 28-year-old daughter whose day program is closed, and I hired, I had personal care attendants before, and because Massachusetts very wisely saw fit to say, well, they're not in the day program, you have extra hours, been able to hire one of the staff people for home. That also means that I'm going through we get gloves pretty much when with some of her other supplies. And I'm going through things a lot faster now because she is home 6 extra hours a day. So, and there's, I mean, luckily my 2 aides are great and they come, they have masks, but we are running through things a little bit quicker. So I did contact our medical provider, and they said, well, a standard order is, I think it was 400 gloves a month or whatever it is. Obviously now I'm going to be going through those at a much faster rate. And I think that needs to be taken into consideration, that whatever we're using at a faster rate. We may have multiple people coming into our homes, meaning things are not going to be reused by one person over and over. We need to then provide maybe fresh to somebody else in order for everybody to stay safe. And it is a risk that we're taking when we invite other people into our homes in order to provide this care. I am still working from home remotely. My husband is working remote. We're all otherwise working remotely, although we stop when I don't have the care for her, and we all take turns. But we're going to be going through these things at a much faster rate. So I think when they take a look at this, they need to recognize that with multiple people now in a home doing things, what looked like a proper allotment may not anymore be a proper allotment. Thank you.
You want to take the lead on that one, just talking about supply chain stuff, maybe?
Definitely. I mean, I think that, a lot of attention has been paid, rightly so, to making sure that folks literally nurses and doctors literally working in hospitals are getting the PPE that they need. And, those folks certainly do need PPE, but you're right that it's not just those folks. Everyone, and care attendants and home health aides and parents and folks with disabilities also need these things. And Senator Warren really believes that the federal government has a huge role to play in helping with the logistics of developing and producing and then distributing these materials to folks that need them, and making sure that states aren't fighting with each other. I know Massachusetts and Governor Baker has had trouble getting supplies, fighting with states like California and New York to try to bid for things. I think that's something that shouldn't be happening. And I think a key way that we can work at the federal level is to keep pushing for the expanded production of these materials, as well as data collection on areas and communities and others most hit or hardest hit by this virus, so that we can make sure that we're using that data to distribute the materials to where they are needed most. Adam, I don't know if you have anything to add.
Yeah, I would just say my boss regularly says that you can't legislate competence, which I think is a challenge that we're all facing, and how to try and encourage the federal government to respond in a way that actually meets the needs of this crisis. And so we're doing, I think, what we can, which is drawing attention to where they're failing and where they're not taking into consideration things like personal care attendants and others that are not just in the hospital space that have a need for this PPE, and trying to get them to recognize that. I think both of our bosses have been really active in encouraging the federal government to take a bigger role and take advantage of the authorities that they already have under the Defense Production Act and others to try and get us really on a wartime footing, which is what we need to be doing, to produce and get the PPE that we need and distribute it, make sure it's getting into the hands of the people that need it the most. So I appreciate you raising it. It's absolutely a critical issue, and it's one that I think both of our offices and lots of other folks here in DC are trying to bring as much attention to bear on as we can.
Great, thank you. Does anyone else have a question? Has there been any response to the letters that you've sent leadership?
My understanding is that I know that, it's been communicated to Senator Schumer on our end and Leader Pelosi as well. And I think our understanding is that on the House side, as they're developing this package, these issues are not only being brought up by us, but are being brought up by other members as well. So we are hopeful that the initial draft of the C4 package, which we're expecting either sometime mid to late next week or the week after, the latest I heard, though that could of course change, will include sort of some key provisions of this. And I know on the Senate, Senator Casey has been doing a lot of work, as Adam mentioned as well. I think the challenge is really going to be in making sure that the provisions that we want that are included in the House package are, one, strengthened if they need to be, and two, make it through the Senate, in which Leader McConnell and others have expressed sort of discomfort or an unwillingness to, spend more money beyond what's already been spent in certain healthcare areas, or sort of to only provide a fraction or a little bit more funding. So for things like a $50 billion dedicated fund for home and community-based services, I think that's something that the House will be pretty receptive to, whereas we might get a bit more resistance in the Senate. So I think that what we are trying to do, and what it's helpful that folks like you are able to do, and folks, in your community around the country are able to do, is continue to push, particularly in the Senate among members that might not necessarily be immediately ready to commit to some of these policy priorities, to make sure that they're getting the personal stories, the outreach, to know how important this is to folks, so that we can have a good, fighting chance to get it in the package.
Yeah, and I would just add on to that, one of the big issues in this coming package is going to be around aid to states and cities, something that really has been left out a lot. And what we've been saying is that there are mayors and governors in Republican states that are facing the same challenges that Massachusetts is facing right now. And similarly, there are ARCs all around the country that are facing similar challenges to the ones that you guys are facing right now. And so I think the hope is that folks that are in states that have Republican senators are going to be doing the same outreach that you guys are doing and conveying the challenges that you all are facing. And so I think that's the best way that, as Anna said, that we all can try and push to get in this next package some of the priorities that we know need to be.
Thank you both, Susannah and Adam. Thanks. I just wanted, Christine Hubbard had added that the community provider agencies have spent enormous hours trying to source PPE, and hours that are not spent focusing on delivering direct care. So, we do appreciate all the work that you're doing at the federal level, because that, helps alleviate the states, and it helps alleviate the community provider agencies from having to, figure out how to get PPE. So
can I just say, I saw the comment really briefly, sorry, I saw the comment in the chat, and I just want to hit on one thing. There's a frustration in that comment, and I guess I just want to communicate that we feel that frustration too. Like, I understand where that's coming. Like, these providers that shouldn't be their job. And like I said, we can't legislate competence. We're trying as much as we can, but I just want you to know that we share that frustration and recognize that shouldn't be the job of these, community provider agencies. That's a part of their job, but it shouldn't be as difficult as it has been for them. And so I just want you to hear that we share that frustration.
Thank you. So we're at like 12:30 right now. So I just want to go through a few things, and then if people want to stay on, we can continue on with questions. But there was a slight update with the IRS guidance around the economic payments, and I just wanted to add, because this had come up in a previous webinar about someone had asked whether she needed to return her husband's payment who had died in the past year. And there's new guidance that was issued on May 6th, and it's in the FAQs around the economic payments. And actually do have to, I know we had originally said that they not to worry about it, but we do need, yeah, you would need to return that money. So unfortunately, I don't know how they're going to enforce this, and it sounds like a terrible idea, but we did want to let everyone know that this was the new guidance issued, and the instructions for returning the payments are in the last question. It's question 41, which is at the bottom of the page for the IRS guidance. So we just wanted to flag that for everyone because it did come up in a previous webinar. And then I just want to remind everyone about the ARC's new story collection tool. It's a really great and quick and easy way to share your story and send to Congress. And we've got new images with the We Are Essential campaign, and there's a link if you continue to share on social media. We really appreciate all the work that everybody's doing in that area. The advocacy has been incredible at the federal and state level, and just keep up the good work. As Susannah mentioned, it's really important to reach out to everyone's senators. We want to make sure that's, nationally that everybody is doing that, and just continue on, with the advocacy. And then just a reminder about the Massachusetts advocacy, that there's that public comment opportunity. There's a reopening advisory board that was announced last week on Massachusetts' plan to reopen the economy. So if you have any comments that you want to submit, here's the link just to let the board know how you're feeling about the reopening and how it's going to impact you and your family. And then, of course, the census. Massachusetts is ranked 20th in the United States for the self-response rate for the census. We just want to keep getting the word out. As you know, the disability community is a hard to count community, and it's really important that we keep up the momentum and make sure everyone is participating, and that the ARC of Mass is a census questionnaire assistance center. So if you have any questions, please contact us. We're here to answer any of your questions. So that's it for me. And then we have contact information for Adam and Susannah here. But if we have additional questions, I just want to check the chat box again. Oh, we've got thank yous. And then Deborah Stevens says DayHab staff have been calling us, checking in and Zooming with our daughter. The continued contact is essential. That's right. But unless anybody has any other questions, we can end here. Just give it a second. But thank you again to Adam and Susannah so much. We really appreciate it. You guys have been very responsive. It looks like, oh, sorry, Diane Fitzpatrick has a question. Do you want to unmute yourself, Diane? Or just type it in the chat box?
Okay, I'm sorry. I joined late, so you may have already discussed this. But my son is 25, and he does work, he does pay taxes, and he even he pays taxes on his paycheck. But he also, if they don't take out enough, he pays at the end of the year as well. And what are they doing for those individuals that, like, I claim him as a dependent, but yet he's working and he pays taxes, and he didn't receive a stimulus check, nor did, of course, I receive anything for him since he was a dependent. Is there any movement for that? Did you discuss that earlier?
Yeah, we did.
We did, yeah. You want to talk about it, Adam?
You can go for it, Ellen, if you want.
Okay. Well, that is in that's something that we're prioritizing to ask for the fourth COVID-19 package. But there is also there's a bill in the House and a bill that will be introduced soon in the Senate that has a lot of supporters. It's called the All Dependents Count Act, and it would extend coverage for their recovery rebates to dependents over the age of 16. So that would include your son. So if you claimed him as a dependent, it would allow you to get that recovery rebate, which is the $500 stimulus payment. So that is something that the ARC has been advocating for, and on the federal level. And so that's one of our top priorities. And I know that Senator Warren and Senator Markey both support the bill. So
Thank you.
but thank you for the question. Looks like we have a few others. Tina?
Yes, thank
Tina
you.
Perkins?
Yes, thank you. My son actually just turned 22 on March 8th and moved home from his residential school. And he had been, it was supposed to start a community-based day program on March 16th, which is when the whole world shut down here for us. So he moved home from a residential school and is full-time home with me, but we were just in the loop process, the normal process of applying for family support for the offset times of when he wasn't at the community-based day program. Obviously, he's not at the day program because that's closed. And he's home here with me full-time because his father is still working. And yet I'm his legal guardian, and I'm not, quote unquote, allowed to be his provider, but I am his provider. So I'm curious if this has already been addressed before, or if it can be addressed. Can the legal guardians be the family care provider? Because we are.
Thanks for that question. And yeah, that has been coming up a lot. I know in calls that our team has been doing. And I know that different states have sort of different ways for how they handle this. So we are currently working with sort of internally to try to figure out the best way to address this on like how much of this needs to be handled on a federal level and what federal government can do to encourage states to make changes to their Medicaid programs and sort of other programs that could provide allowing folks to basically make it possible for folks to be providers that are legal guardians. So I don't know, Adam, if you have anything to add. I don't have anything sort of specific right now in terms of a letter or a bill to point to right now, but I can confirm that we are hearing about this a lot. We're actively working on it. And I think, to your point, this is a totally unprecedented situation, and you are, and many others like you are providing care. And so we're trying to figure out what we can do to be most helpful.
And I think this is something that I had mentioned earlier about doing a mass allegation sign-on letter. I think this is something that we might include in that. But yeah, echoing everything else Susannah said.
Yeah, and Tina, just so you know, and that's a very important issue for the ARC as well, and we're working on it at the state level and talking to Mass Health and other agencies about it. So I appreciate that your comment, because that is something that we're hearing from other families as well.